fraud and falsifying financial records.
The disappointing May jobs report adding more fuel to the debate over the best course for the economy. Joining us now, Republican Congressman Michael Grimm of New York, a member of the Financial Services Committee. Good morning, Congressman.
Good morning.
You voted against raising the debt ceiling for, I think, the Ryan plan, so we'll start with that. That's where
Sure.
you are on that. And then recently, I'm quoting after the Case-Shiller numbers that we had showing the housing market weak, and then this was before those jobs numbers. But I urge President Obama and the Senate Democrats, this is your words, to wake up and to abandon their failed policies. Wake up to reality, abandon their failed policies. I mean, those are fighting words, especially to Ernesto Jared Bernstein, one of the architects.
Personal.
Not personal.
It's not
Which
personal.
failed policies?
All of them. The idea that they want to tax more, borrow more, spend more, and overregulate. All of it is creating an environment where a business can't flourish. On top of that, we have nothing coming out of this administration but uncertainty. When you look at overwhelming Obamacare, the sweeping legislation, Dodd-Frank, all of these policies, yes, there's a ton of money sitting in corporate coffers on the sidelines because no one knows what's going to happen. No one knows how to put a business model together for the future. I mean, Dodd-Frank in and of itself says the SEC is going to look at something for 18 months. So if I'm a businessman, if I have a small investment firm, I'm going to wait 18 months and find out what the ruling is before I invest in it.
How do you argue, Congressman, against the counterfactual? What do you contend that we're at 9.1% unemployment? Where would we be without that $800 billion? What was it called?
The market analysts will tell you you'd be at 11 or 12% unemployment. But, you know, I don't ever think that that's really that convincing. I mean, people face a tough job market. I did want to say, though, I mean, if you think back to where we were back in 2009, I mean, GDP was collapsing, 6% negative, as I recall, fourth quarter of 2008. You know, unemployment, the jobs numbers, you know, we think 54,000 is a bad month, and I take that point, of course. We were losing 780,000 jobs a month back then, and then you saw this spate of interventions which helped turn things around. How is it that, in your view, those are completely discredited? It just doesn't seem to match the evidence.
Well, actually it does. Right now, we're stagnant and we're increasing. Of course, when you spend that much money, you're going to get a little bump, but there's no long-term goal here. Where's the long-term goal to rebuild the economy to get things moving again? And let me ask you this, spending all that money, where does the uncertainty and overregulation help grow our economy? How do we compete with Brazil, with China, with Singapore, with all of these other countries that have now emerged, and they don't have these onerous rules and regulations? How are we going to compete?
I think you make a great point on short-term versus long-term. I think that's really an important distinction here. But let me talk for a second about that long-term, because one of your votes I find disturbing in the following sense. One of the things we clearly need is an adequately funded government. And one thing I really thought was wrong about the Ryan proposal that you supported was the idea that you're going to transfer, you know, so much money to the top end by cutting taxes at the top rate. How does that square this transfer of $800 billion over 10 years to folks who are actually doing pretty well right now? How does that square with trying to actually get our fiscal house in order?
It's actually very simple. If you look at the Ryan plan, and again, the Ryan plan is an overlay. It is a large blueprint. There's a lot of things via committee that still have to be worked out. I don't think the Ryan plan is perfect. I think it's a starting point. It's a lot better than abdicating responsibility and not leading at all. So I think we had the political courage to put it on the table. That's one. Now, specifically to your question, by lowering the tax rates but getting rid of the vast majority of exemptions, I believe people are going to pay more taxes. There's going to be an increase in revenue, certainly on the corporate level.
So they'll pay for themselves? The tax cuts?
The tax cuts, I think it'll
I got to say, that's been the playbook for your side for a long time, and it really hasn't
worked. But we've never gotten rid of the exemptions before, so I disagree with you. Have we ever gotten rid of all the exemptions? I mean, let's look. GE didn't pay any taxes at all. Is that a good structure?
No, I agree with you.
In this country.
No,
does that make sense? I mean, let's repatriate the monies that are overseas. Let's get them back in this country. Let's not penalize them. And let's make it fair so that everyone pays their fair share of taxes. I think that's just smarter on every level, not just from a business level, but, you know, in my own home, I want things to be across the board fair.
So you want people to pay more taxes, but also less taxes?
No, that's not what I'm saying. What I'm saying is if you lower the tax rate, make it competitive with the rest of the world, but get rid of a lot of the exemptions, people will have a fair tax rate, but they'll pay all of the taxes they're supposed to instead of avoiding the taxes they're supposed to be paying. That's the difference.
Mm-hmm. the other piece of the Ryan thing that I find troublesome, and I think a lot of voters are, is this idea of privatizing Medicare, the idea that you give folks a voucher that doesn't keep up with the value of health care over time. That clearly hasn't worked politically for you guys. Is that something you support?
Well, first of all, you miscategorized it in the beginning. It is not a voucher.
It's not a voucher.
It is not a voucher. It is not a voucher.
And you can't exclude people. There's a lot of, you get to say whatever you want, but no, go ahead.
No, a voucher is when you pay to the person individually, and then they go out and pay for their health care. This would be paid directly, and it would still have the government guarantee. I personally think, and a lot of my colleagues think, that Medicare was destroyed as we know it via Obamacare, taking $500 billion out and putting up a bureaucratic panel of 15 to decide what seniors are going to get and not get. And that affects current seniors. The Ryan plan, which again is not perfect, doesn't affect current seniors. It affects those under 54 years old, 10 years away from retirement. That's a big difference.
You said something here that I hadn't heard before, and I want to dig a little deeper. The Ryan plan preserves guaranteed fee-for-service Medicare? That to me seems...
It still has the government guarantee, just like Medicare does now.
But Jared, I mean, if you look at Medicare, it's going to go bankrupt.
Right.
It's a falsity to say that the way it exists today, it will continue to exist in 20 years. So something has to be done.
You can say that till 2012.
Right. No, there's absolutely the case that you have to cut Medicare spending. No question about that. The question is that I'm asking here is that my understanding is that the real flaw in Ryan's plan is it ends the guarantee. That is seniors, retirees can go to the doctor and are guaranteed health care. They don't have to...
The guarantee is still there under the Ryan plan.
They don't have to shop. So the guarantee is still there.
Under the
They are
Ryan
guaranteed health insurance coverage under the Ryan plan.
Yes, and here's the other thing that actually makes a lot of sense, and I think both sides of the aisle should embrace this. If you are older and sicker, you get more money put towards your Medicare. If you are wealthier and healthier, you get less. So it is a bit of a means test for those that are, we keep hearing about the millionaires and billionaires, they would get very little towards their Medicare because they don't need it. So it's, and the other thing is, look, 10,000 people a day are being added to the rolls of Social Security and Medicare. 10,000 a day. On the other side of the coin, people are living much longer than we ever anticipated. When actuaries set up Medicare, they didn't expect.
Wait do we have this doctor on that we're going to have on in a few minutes, and how expensive all of these targeted cancer therapies are because they cost so much to develop. And we're going to have so many baby boomers, and we had Greenspan on. The last 6 months of an individual's life at 90 years of age, you can spend $400,000 in the last 6 months. We have nothing to educate our children with.
The real point is, and I think it was just mentioned, if we do nothing.
Yeah, no, you're right about that. We can't.
Then it goes broken. Our current seniors don't have it.
We
That's
agree
unacceptable.
on that point. Where we disagree is your characterization of Ryan's plan as guaranteeing people the same service that they have now. I really think that's just an incorrect...
But Jared, my problem with this is you jumped in on him and said, wait a second, your party is going down this path. It's not very popular. Where do you stand on this? Where do the Democrats stand? Where's the counter plan?
Okay.
That's my problem.
I think that's a great point.
I think
it's a great point. And I think it's underappreciated that what you're calling Obamacare, health care reform, actually cuts $500 billion.
No, it doesn't. Healthcare reform added a lot of people to coverage, and that was one of the problems that we had with
That's on the Medicaid side. I'm talking Medicare.
Which is a good issue.
We're talking about the sustainability of Medicare.
But you played with all kinds of numbers. You used 12 years or 10 years of taxation for only 6 years of service that were covered on these things. The cost care curve was not bent under Obamacare. That was the second half that was not dealt with.
No. My point is that in terms of Medicare spending, this bill, which, by the way, Ryan preserves this point in his bill, cuts $500 billion off of Medicare spending over 10 years. That's in the books. I mean, you can look up the CBO numbers. After that, we are all on the same page. After that,
something has to be done.
Something has to be done. But what has to be maintained, in my view, is health care security for older people. And I think what Ryan does is have you shopping for insurance, and if it's not a voucher on your side, it's a voucher to the health insurer, a voucher that doesn't keep pace with medical costs.
That's a fair point. You're looking at it, getting rid of some of the expenses and taking some of that uncertainty off of the government.
You're shifting that kind of exactly. You're shifting it onto the
and even though 55 might not seem that old, you're dealing with a huge wave of people who've just lost a lot of money in their retirement and in their stocks.
Right, but that's why it's so important. If we don't do something now, this safety net won't be there.
The longer we wait on this, the bigger problem and the more draconian the responses are going to be, too, that you need to come up with. So I do believe to have a fair and honest conversation, something has to be done.
And it comes down to
we started the fair and honest conversation. We've been demonized for it.
You think 15 bureaucrats are better than trying to do this with market forces?
Let me say, the person who started this conversation was President Obama. This was the president who put health care on the table, who proposed and managed to work through Congress.
He's still dealing with the negative effects of all of that.
And to me, that's actually...
You saw some of the effects in
that's
2000,
to his credit.
in the 2010 election. You saw some of the effects.
That is to his credit. He did not put his finger up to the wind and say, boy, if I touch this...
On his most recent... When he was hammering and chastising Ryan, who was in the room with his deficit proposal, his only answer to Medicare was ending the tax cuts for those above $250,000 and looking at inefficiencies in the system. He punted on that completely.
Oh, no. I mean, that's another conversation. I'll be happy to have it.
Well, what was his idea for Medicare?
The cost controls in Medicare are actually really the most important part of all of this.
In Obamacare?
Yeah.
Oh, you won't call it that.
In terms of health care reform. This is the
Affordable Health Care Act.
The Affordable Care Act.
What are the Bush tax cuts?
Since that plan has come out, I have heard nothing from every single business owner that I've spoken to other than their premiums have gone up.
Oh, well, that's because the
ones that didn't get waivers.
That's because the cost-cutting measures have yet to take effect. And by the way,
if it's so good, then why have so many waivers been given out?
I'm not saying, by the way, that these cost-cutting measures are absolutely necessarily, I'm sure, going to work. But I'm saying that we have to try them. And by the way, what we're talking about here is called the IPAB. This is an acronym for the group that's going to try to figure out what are the most cost-effective ways. You can call it a and give vouchers to seniors and say, good luck out there in the open market shopping for insurance. It is vouchers. It's just, your point is correct that it's not giving vouchers to the individuals.
But it does take the responsibility off the government and put a lot of it back on the individual.
The transfer of money may be different, but...
It just doesn't cut costs, and that's what we have to do.
Well, we think it will. We think that by bringing in the marketplace so that it's not just the government setting everything, that there'll be more competition and will lower costs.
Unfortunately, in the healthcare sector, depending on the marketplace, just ain't going to work out for you.
Well, I guess time will tell. But at least we all agree one thing. We do have to try something.
It's a conversation that needs to take place.
At least Paul Ryan and the Republicans put something forward and got the conversation started.
Thank you. Great to have you in studio. And hopefully we'll see you again. This is the beginning of a relationship we have on Squawk. Because you're close, aren't you?
Yes, I'm in Staten Island.
Yeah.
Staten Island? That's right. Yeah, that's nearby. All right, thanks. Coming up at 8:30 Eastern, we'll get the latest on the road.